Welcome back to Lip Service Lounge, and we are on part 4 of Total Body Care for a Woman. And on part 4, we will be discussing or sharing information about cycles. And again, that was the premise of me doing this video series because I really wanted to speak with young women, young girls that were starting their cycles pretty early about the best way to maintain their bodies and deal with being on their cycle. But before we get into that, I guess I'll just explain a little bit about why you have a cycle so you'll really kind of understand that. And I have this neat little diagram. I saw it and I thought, oh, what a wonderful illustration. It's actually a pair of panties that have a picture or a diagram of what a woman's insides look like. And I like that it was on the panties because with a pair of panties on, it really gives you a good sense of what the inside of you looks like and where everything is positioned on the inside. So you have a picture of your vagina, your cervix, and then the uterus, and then your fallopian tubes that are located on each side, and then your ovaries. So when a woman is born, all of the eggs that she will ever need or produce in life, and plus many more, are there when she's born. So she doesn't have to make new ones. They're already there, and they're released each month when you begin to have your cycle. Now, an average cycle is about 28 days. It can range from 21 to 35 days, but it's usually about 28 days from the first day you have a cycle to ovulation until the cycle occurs all over again. So what happens is that your body has these eggs that are released out of the ovaries that travel down the fallopian tube, and they lodge and attach themselves to the inside of your uterus wall. And the uterus wall contains tissue that's called endometrium. And that tissue gets thicker and thicker during the course of the month in preparation for that egg to come down. Well, the reason the egg comes down is allows a female to become pregnant. If a man's sperm enters the vagina and then travels up to the uterus and meets this egg, it will fertilize an egg, causing a baby to begin to be produced or developed in the uterus. So, when your body starts to menstruate, that means that your body is saying that it is prepared and ready to have a baby. Now, that does not mean that you are mentally, emotionally, or financially ready to have a baby. It's just that your body is maturing in such a way that it will allow the process to happen. So, if that egg that has been released from your ovary, that has traveled through the fallopian tube down to the uterus and attached itself to the wall, if it is not fertilized by a sperm, then it just simply drops down into your vagina and then it's released. Well, that means a pregnancy did not occur. You did not get pregnant. A pregnancy did not take place. So all of that endometrium lining, that tissue that I said got thicker as the month went on in preparation for the egg. After the egg is released, that endometrium lining is released. And that is the blood that comes down from your uterus through the vagina and out of your body. And that is what you see each month as your cycle. Now, cycles are different for different women. Some women have cycles that last for 3 days. Some women have cycles that last for 5 days. And some have cycles that last for 7. All of those are normal. So if you're talking to one of your friends and yours is 7 days and hers is only 3, that's normal. Different women have different cycles. Different women also bleed differently. Some have a very light flow and some have a very heavy flow. Some flow heavy at the first few days on their period, and then it gets lighter at the last few days of the period. So all of those things are normal for a cycle to occur. But I just wanted to give you a little history as to what is happening in your body and why you are able to have a cycle each month. So, for you ladies that have yet to start on your cycle, it can happen any day. Again, it can begin in a young lady as early as 8. In some cases, it has happened earlier or as late as 14, 15, or 16. You just never know when that day is going to occur. So what I recommend that each young lady does is carry with her daily a little pouch that I call it a cycle emergency kit. And you can carry a little pouch like this. You can put it in your book bag or your purse. And this pouch contains everything that you will need just in case your cycle starts when you're away from home. If you're at school, at church, at another event, or at a friend's house, you have this with you. So the pouch contains, if you started your cycle, you probably had a blood leak onto your panties. So you want to take a clean pair of panties so you can change into a fresh pair of panties if you're at school or anywhere that's away from home. So you want to have a fresh pair of panties in your emergency kit. You also want to have a couple of pads because you're going to need some protection so you won't mess up your clothes for the rest of the day. I prefer always maxi pads. I prefer always maxi pads that have wings on them because they ensure a full protection. So I'm just going to open one up. So this is the length of the pad. And then if you peel this extra little paper off there, you'll see it opens up. And these are called wings. And you just simply put the pad in the crotch area of your panties and fold the wings over. And this allows you to have protection from the blood staining your clothes while you're on your cycle. I'll show you how to use that in a second. You want to have fresh panties and pads, or if you want to use tampons, you certainly can store tampons in your emergency kit. They make these nice little cute ones so that when you go to the bathroom, you can kind of discreetly hold them in your hand. And they make the ones that are longer. And these are to be worn on the inside as opposed to a pad that's worn on the outside. I'll show you how to use those as well. You also want to keep panty liners in your emergency kit. These are like pads, but they're much smaller. And you wear these especially if you decide to wear tampons, because if blood leaks past your tampon, this will protect your panty, so your panty won't get stained. And you want to change this just as often as you change your tampon if you're wearing a tampon, okay? And last but not least, you want to keep flushable wipes. Now, they make wipes for women with all types of scents and fragrances on them to keep your vaginal area fresh. Again, I don't like any of those products because they are not hypoallergenic. They have scents, they have dyes, they have all kinds of stuff that can irritate your vagina. This doesn't have any scent, doesn't have any fragrance. It's hypoallergenic and it's alcohol free. And most important, it's flushable. So you can use it in any restroom and not worry about clogging up the toilet. And this is just used to cleanse yourself before you put on your fresh panties and your fresh pad. So those are must-haves that you should keep with you in your emergency kit just to make sure that you are ready. I also recommend, if you are in middle school and you have a locker, or if teachers, again, I said I had a lot of friends that are educators and they notice that the young ladies are starting their cycles early. I don't know if there's a special place in your classroom where you can keep an extra bin, where all of the young ladies can bring an emergency pair of pants to keep in that bin just in case such an emergency happens. But you have these little cute pants that are called jeggings. And they don't take up much room. They don't take up much space. But in case you've stained your clothes, you have these that you can keep in your locker to change into a fresh bottom. Or if your teacher makes a space in your classroom or in a cubby, you can keep them there so you won't have to worry about going home and missing school or having your parent pick you up because you messed up your clothes. So those are things that you keep in your emergency kit. So now it's very important, whether you wear a pad or a tampon, to change your pad or tampon every 2 to 3 hours. it's dependent upon how heavy your flow is. If you're bleeding really heavily, you want to change every 2 hours. If it's moderate to light, you may be able to make it to every 3 hours. That keeps the moisture down in the area, it keeps you from getting infection, and it keeps you from smelling, and it keeps you from it eliminates the chance of you having an accident, because the pads and tampons can only absorb so much. So if you don't change every 2 to 3 hours, you saturate the pad or you saturate the tampon, and then you start to get the overflow that runs onto your panties and to your clothes. So it's very important that you're mindful about how long you've had your pad on and when to change it, or your tampon. So again, you want to take this pad, and this is the crotch of your panties. This is the part that goes in between your legs. So you want to take your pad when you're putting it on and lay it right in the center of the crotch. There should be some that comes up the front and some that excess that goes on the back. Okay? You want to make sure you press it down so that it will stay in your panty, and then you simply take the wings and fold them over the sides. And this helps protect you from any leakage or additional blood that may leak off the pad. So that way you're covered completely on the inside and then on the outside. Okay? And again, it's very important to change every 2 to 3 hours. If you want to use a tampon, this outer portion is called the applicator. They're usually plastic, and it makes it easy for you to insert the tampon. So I'm going to use a little illustration again. So you would take the tampon, the applicator, and insert it into your vagina. Okay? Now, I don't know if you can see, you have the thick part here, and then you have this little plastic part, and then you have the tail, is what I like to call it. When you're inserting the tampon into your vagina, you want to hold the little middle part. Push it up, and then when your fingers meet your vagina, you push it all the way up, and your fingers are meeting your vagina where you on the little middle part. You know you've pushed it far enough, and then you just simply take your forefinger and push the tail up, and that will release the tampon out. You push up, and the tampon comes out. This is the part that remains inside of your vagina, and it collects the blood. Okay? You push the tail up, the tampon pops out, and then you just pull the rest of it out. This is the part that you discard. I usually like to take the wrapper that the tampon came in and just put it back in the wrapper and just discard it in the trash. Okay, if you wear a pad, never, ever, never, 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 ever flush a pad down the toilet. At home, at school, anywhere, because it could clog up the toilet. I suggest when you remove your pad, you're going to have a new package that you use because you're going to put on a new fresh pad. Just take off the soiled pad, roll it up really tightly, then take some tissue and wrap it as well, and then use the new packaging from the fresh pad that you're going to put on and roll that down. Make sure it's tightly sealed, and then throw it away. Just simply throw it away. That's what the trash can is for. That way you don't worry about clogging up the toilet or anything. So that's how you discard a pad and a tampon. Panty liners the same way. You just simply roll down. Use the packaging from the brand new fresh panty liner that you're going to put on. Roll it up the same way. And just discard it. So, that's how you manage making sure that you're clean and fresh all day when you're on your cycle. You can also use those wipes in between changes. You want to make sure you just kind of clean yourself, the excess blood that may have leaked out to prevent your panties from staining or anything of that nature. That's very important. I like to keep what I call period panties. These are panties that you may have had that you've gotten soiled or stained, and you wash them and you just wear them every time you're on your period so you don't mess up any of your new panties. So it's a good idea to have about 4 or 5 pair, however long your period is, of period panties to wear. And there are several different brands of pads and tampons that you can use. Like I said, I always like always maxi pads. I prefer Tampax tampons, and then you have Kotex, which is an old brand name that's been around forever. Pads, panty liners, and tampons. Now, something that I like to recommend for young ladies, particularly at night. Now, my niece told me that young ladies like to wear tights when they're on their cycles at school because it helps to keep the pad in place so you don't have to worry about it shifting around. I thought that was a really good idea. What I like to recommend is something very similar when you're sleeping at night, because you tend to bleed a little heavy sometimes at night, and you can stain your gown, you can stain your bed, the sheets, and all that good stuff. But to help keep your pad in place, if you have pantyhose or tights that you've torn up, got a hole in or run in, just simply cut the legs off. Cut the legs off, discard the legs, and then keep the top part. These are good because the top parts on pantyhose or tights are really tight sometimes. And that ensures that will hold the pad in place. So when you cut the legs off, what you're left with is like these little tight shorts. And you put them on top of your panties at night. And that keeps that pad securely in place. It doesn't move around. So that decreases your chance for an accident or bleeding in your bed or bleeding on the sheets or anything of that nature. So this is a really good idea. I've been doing this for years and years and years, and I've not messed up sheets or anything yet. But if you're a heavy bleeder and you still bleed through that, you can always wash your sheets. Some ladies put towels down, but I find that towels get kind of hot at night. What you can do, again, is go to Walmart and purchase a mattress protector. These are like, they're plastic. You put this on your mattress, and then you make up your bed as normal with the sheets on it. So if you do bleed through your underwear and through your tights and through your sheets, your mattress is protected. You don't have to worry about staining your mattress. So you can just take your sheets off and simply wipe the mattress protector down with warm soapy water. And then you're good. If you find that you don't like the mattress protector because they can be a bit noisy as you're moving around until you get used to it, you can use a waterproof underpad. And it's just another type of pad, and it's soft. You can place it right below the area where your private part hits in the bed. And if you bleed through everything, again, you'll bleed through the sheets, and then it'll land on this part, and you don't have to worry about it staining your mattress. You can simply clean again with warm soapy water and not have to worry about soiling your mattress. Now, if you do soil your panties, as soon as you get home or as soon as you get to a place where you can cleanse them with cold water. Cold water removes blood. Not hot water, not warm water. Cold water removes blood. So just soak them in cold water, and it'll help eliminate those stains. Okay? So these are all the things that I like to use to ensure that my cycle is okay, that I don't have any accidents, and that I'm taking care of changing on a regular basis. Now, something I like to say to teachers, I've spoken to many young ladies that say that they have a difficult time asking for an excuse to get out of class to go take care of changing their pads or their tampons so they won't have an accident. Teachers, I'd like you to consider that women need to change their pads and their tampons every 2 to 3 hours. So it's very realistic for a woman to have to get in her class at first period. If you put a pad on about 6:30 in the morning because you were getting ready for school, by the time you get to school and have homeroom and get to first period, it's around 9:30. It's time to change. So please allow them to go to the bathroom to prevent them from having to deal with any embarrassing moments at school. Of course, if you have individuals that are habitual, you deal with those individuals on a one-to-one basis. But women, the young ladies really need to get out of class to be able to go and change their pads. There are a lot of things that are associated with cycles. Some women are lucky and you don't have any cramps or you don't have anything. Having cramps is normal. Usually you can take a Midol or Advil or ibuprofen to help alleviate the pain from a cramp. But if you're experiencing severe cramping, then you really want to pay attention to that. That is not normal. There are several things that could be occurring in your body. One of those things could be endometriosis. And that again goes back to the lining that we talked about during the month when your cycle is preparing itself to come. The lining of the uterine wall gets real thick, and that lining is called, or the tissue is called endometrium. And for some reason, some women have endometrium that grows in other areas outside of the uterus. It can grow anywhere in the body, and that causes pain. And it continues to grow, but it doesn't have a way to release itself. The endometrium that grows in your uterus, it expels itself when you have your cycle. It just simply comes out through your vagina. Well, if it grows over here or somewhere else, it has no way to rid itself. So it kind of becomes like a scar tissue in your body. And it is extremely painful. It can cause cramps. So the word is endometriosis. And again, it's simply a female health disorder that occurs when cells, the endometrium, grow in other areas of the body. This can lead to pain, irregular bleeding, and problems getting pregnant when you're older. So some of the symptoms are severe pelvic pain, painful urination, painful bowel movements during your period, severe abdominal pain before and after your period, lower back pain, heavy periods, or spotting in between your periods, and fatigue. So if you notice that you have any of these symptoms, if you have cramps that are so debilitating that you have to miss school, that you can't get out of bed, that it just really alters your lifestyle and your ability to enjoy life, you may want to go to the doctor because you may have what is called endometriosis. And there are several things that they can do to treat this. Oftentimes, women can have endometriosis and it not cause any symptoms, but when it does, it's pretty severe. And they can give you different things or look into different options to help alleviate the pain of endometriosis. So be very mindful. It is not normal to have cramps to where you cannot move and it's really painful. The next thing that you could be experiencing, if you're having incredible pain or heavy bleeding, this is one I really, really want to discuss. It's called uterine fibroid. And if you are bleeding so heavy that you have to stack pads, meaning you have to wear 2 or 3 pads at one time, that is not normal. Absolutely not normal. If you're bleeding through your clothes on a daily basis the entire time you're on your period, that's not normal. If you're having a period that lasts for 2 or 3 weeks, that's not normal. We tend to think things are normal because we don't have conversations with other women or other girls, or we're embarrassed about it because it is such a big deal in our lives that we tend to think it's normal. It's not. If you're experiencing any of those things, you really need to see a doctor. You could have what is called uterine fibroids. So uterine fibroids are non-cancerous tumors that develop in the womb or uterus of a female reproductive organ. And they can range in size from as small as like a quarter or a golf ball to big as grapefruits. You'll notice that you may have weight gain in your tummy, and no matter how much you exercise or whatever you do, it just doesn't go away because those grapefruit size fibroids are in there, and they can cause pain. So you will experience painful periods, heavy bleeding, prolonged bleeding, spotty between your periods, and the extreme bleeding can cause iron deficiency because you're losing so much blood. And some of the symptoms are, you experience pressure in your pelvic pain, pressure in your bladder, which will cause frequent urination, or pressure in your rectum, which is your bottom, which makes it very painful and difficult for you to have a bowel movement. And there are several treatment options there. There's hysterectomy, which removes the whole female reproductive organ, a myomectomy, which removes the fibroids, and then uterine fibroid embolization, Now, I'm discussing these, and I know parents of young children might be thinking, why is she talking about these things? Yes, these things typically happen in older women, 25 to 30, but they've been known to happen in women as young as 12, 15. So I just want you to be aware of the symptoms and not live and suffer in silence in this pain. So you really need to be mindful of what's happening with your body during your cycle so you can know when something is abnormal. Something else I want to discuss really doesn't have to do with your cycle or periods, but it's another thing that can happen to women. Yeast infections. They are very common. They are not sexually transmitted diseases, but they can be transmitted sexually. But it's really an infection. It's called vaginitis, vaginal candida. And it's just an overgrowth of yeast in your body. Babies can have yeast. People can even get yeast in their mouths. So there are a few different causes of yeast infections. If you have strep throat and you've been prescribed an antibiotic, a lot of antibiotics cause yeast infections. So you get rid of whatever your issue was, like the strep throat, because it kills all of the bacteria. Well, it kills all the bacteria, even the good bacteria that's in your vaginal area, and causes an overgrowth of the bad bacteria, which causes a yeast infection. Your clothing. You have to make sure you're not wearing tight-fitting clothing. Ladies, it's imperative, young girls, that you wear cotton underwear. It allows your vaginal area to breathe. If you're engaged in any type of sport or activity, as soon as you get home, change out of those underwear, because chances are that you sweated in those underwear and it's moist. Warm, moist areas are breeding grounds for yeast infections. So you want to make sure you always have on clean, comfortable, well-fitting cotton underwear. Chemicals can also cause yeast infections. Foods that you eat. I tell ladies to be very mindful of the things that they ingest. Very sugary foods, candies, cakes, pies, all those types of things, as well as a lot of bread, will cause a woman to, could cause a woman to develop a yeast infection. So be very mindful of the things that you eat. Injury can cause the yeast infection, as well as a weakened immune system. So you really want to be mindful of these things. And symptoms of the yeast infections are feeling like you have a extremely itchy vaginal area or a burning sensation. You also see clumpy white stuff in your underwear. It can cause you to have a different odor, a smell in your vaginal area. Those are typically signs that you have a yeast infection. A good way to avoid yeast infections, again, is to avoid that warm, moist area, keeping things pretty dry in your vaginal area. Drink plenty of water. You need to relax on the Kool-Aid and the fruit punches and all of the sodas. They all contain sugar, which is not very good for your body. So drink as much water as you can. Eat a lot of citrus fruits, pineapples, oranges, anything that's citrus, because they are high in vitamin C and they help build your immune system. You also want to check for possible signs of infection. It's very good to know your body. Once you know your body, you really can spot when something is going wrong with your body. I've already discussed wearing 100% cotton underwear. Maintain good, proper hygiene for your entire body, particularly in your vaginal area. Change your pads regularly, every 2 to 3 hours. If you don't, a breeding ground for yeast infections and other terrible things to happen. Avoid using scented products. I've already discussed that. Try to stay away from products that are heavily scented, fragrance. Look for products that are made for sensitive skin and that are hypoallergenic. And you have to realize that women do secrete vaginal fluids, and we do have a smell, but it should not be a bad smell. So you just really have to get comfortable with the scents that your body produces, particularly in your vaginal area. But then know it well enough to know the difference between what is normal and what is something that you need to be concerned about. So, ladies, that's all the information I have regarding taking care of yourself when you're on your cycle. I hope this information has helped you. It is information that will prepare you. It is information that will make you feel very comfortable about this natural function in your body. Happens to all women, and we've all had accidents that have embarrassed us. But I'm hoping that this can allow you to be able to arm yourself so that you won't have to deal with any embarrassing accidents. So I hope this information was really good for you, and that you can use it and implement it in your daily life. Share it with your girlfriends if they don't have anyone else to talk to, your sisters, your cousins. Look at it, and if you have any questions, again, go to an adult that you feel comfortable talking to, or someone that you feel like would give you good advice and good information. If you have questions about anything that I discussed in any 4 parts of these videos. And I'm hoping, again, that this helps a young lady to feel more confident about herself, her body image, and all the things that she can do to present her best self. Please feel free, if you have any questions about anything I said and there's still not anyone you feel comfortable talking to, you can always email me at ladon.elliott@lipservicelounge.com, and that's LADAWN.ELLIOTT@lipservicelounge, but it's all one word, runs together with the email address, ladon.elliott@lipservicelounge.com. And I'll be more than willing to answer any of your questions, because it's a bad feeling to have questions and not be able to get the answers that you need. So again, I hope this information was helpful, and I hope it provided tools for you to use. So as always, with love and much love, I hope that this information will help you in your daily life. And I always look forward to sharing and giving information to people that will better them in some type of way. So if you have any questions, you certainly can leave questions or comments below the videos, or you can email me, like I said, and ask anything that you feel that I did not cover here in the series today. Thank you.